Technology today has played a lot more significance than when I first started doing dentistry. When I first started doing dentistry, we didn't have the things we have now. Whether it's a CBCT, we're able to take a full head image of you, look at your airways, look at your nasal airways, look at your jaw joints, look at the development in children, identify cysts, tumors, things that frequently get missed through our regular dental imaging. And we went from doing regular films for x-rays to the digital images, which are amazing on top of it, and then to this, and now we're into scanning instead of impressions. We're into, like I said, the CBCT. And we've introduced in our office 2 different types of lasers, well 4, okay. Getting all the way down to it, we have 4 different types of lasers. We have the CO2, we have what the hygienists use in periodontal therapy to kill bacteria, cauterize the tissues, to clean out those sockets and make sure that your gums are nice and healthy. We have a Sumos laser and an MLS laser, both which produce very similar effects, but go into the tissues to relieve inflammation, tension, increase blood flow, increase healing. And those ones are used a lot by physical therapists. When you have a sprained ankle, you come out of surgery to help it heal faster. And there's so many things we can do with that, from helping Bell's palsy, facial pain, acne, all these things that these lasers do. Technology has just advanced so much. We do same-day crowns in our office, and that's starting, I think, to become more common. We were one of the first in the state to get a CERT machine in our office, at least the one that we have, and be able to do same-day crowns, having you come in. And what's interesting is a lot of people will say, I still want a lab-made crown, because for some reason they think a lab-made crown's better. Ironically, the labs have the same machines now. They just have them on a bigger scale, and the crowns are made the same way. Well, why go through having your tooth prepped, getting done, having it prepped, temporized, telling you to don't eat anything, be very careful. If it comes off, go to the store, buy some temporary cement. It's gonna be 2 to 3 weeks before we get your crown, and then you get it from the lab and you put the crown in, to an hour-and-a-half appointment with us. We go and we prep it, we digitally scan it. It's designed through a computer. The doctors take a look at it. The doctors have to say how the design comes out. How many labs let the doctors view preliminary the crown to say this is what I want? We just assume a tech knows what he's doing. And then we have a say, and then it's manufactured, and we are able to bond that in instead of just cementing it to your tooth.